So now we're into the third article of our journal club, and hopefully you're finding that the terms are starting to become familiar. This article, Microinstability of the Hip, it does exist. Etiology, diagnosis, and treatment, brought to you again from Dr. Safran's group in San Francisco, California at Stanford. What Dr. Safran again is getting to do for us in this review article in the Journal of Hip Preserving Surgery is tell us and introduce to us the idea that there is something like microinstability of the shoulder. And what we mean by microinstability is a joint that doesn't want to hold its center, and therefore the muscles are working super hard all around the joint at all times to hold the joint center while we're doing sports. And this can create the illusion that the problem's in the contractile or muscle layer, when really the problem is underlying in the inert or osteochondral layer, where that hip is just not stable. Dr. Safran is doing a really excellent job, as always, differentiating the anatomy surrounding the hip from the central joint structures that may be unstable, causing that anatomy surrounding the hip to stabilize the hip. When you're finished reading the article, you really want to be open of mind to understand when you're evaluating your athletes for chronic hip pain. Is there a sign of general looseness of tissues? Could this possibly be someone that has some underlying microinstability? And you want to be able to look through that evaluation process and have a good summary of it following your time reading this article.